Hello and welcome to week 2 of the Level 3 Health and Social Care Unit 4 Person-Centred Care. And in this session we're going to look about personal attributes and how they inform practice. So we're going to address the criteria 1.3, which is about defining the personal attributes required in health and social care and how they inform practice. So we're going to look at that in these sessions. So in about 2012, a document was created called Compassion in Practice. It came out of a week of action where lots of people representing different care agencies got together. And they developed a national strategy out of that week for nurses, midwives, and also unqualified care staff, like care assistants, working in both the private and the public sector. And it was really a bit of reflection because we were looking at health and social care to be much more integrated. So not that division between those who work for the NHS and those who work for care providers, but finding way that their roles could be integrated so that it was more interchangeable. People could move from one role to another, but also communicate from one direction to another as well, instead of being quite separate as it has been. And it's a way of acknowledging that a lot of the work that you do across the two sectors is not really that different. It's often a continuation of each other's work as well. So um, to do that, they wanted to bring together more consistency, particularly between, say, the unqualified sector and the qualified sector. The qualified sector has always had quite a lot of rules and regulations, the nursing and midwifery and social work. But the unqualified sector hasn't always had that same sort of codes of conduct and that sort of explanation. So it was about bringing those things together again. So we're going to look at what is known as the 6 C's, and each one of them can be defined. And the first one is about care. The first C, probably not a surprise really. Care is the core business of what we do, and of whatever organisation you work for. You're actually there to care for people and to deliver help to the individual. And caring needs to define you in this role. So people who receive care expect it to be right for them, and hence we're looking at person-centred care, and it needs to be consistent. So one thing you need to be able to do this role is to be able to comfortably provide care and show that you do care. And that's really quite important. The second C is communication. And that's really central to actually developing your caring relationship. You need to be a good communicator. You need to be a good communicator, not only to your service user, but also as a member of a team, to be a good team worker and to be good and effective at what you do. So communication in all sorts of directions is really important. Needs to be done quite consistently again. And you need to sort of really listen to what people have to say. Again, it's an important element of person-centered care. Remembering the service user's mantra of no decision about me without me. That's, not making decisions without involving your service users. But it has benefits in all different examples of the workplace. So someone who has good communication skills will always be sort of looked at, as appropriate for the role. Compassion. Compassion is about how you give your care. Do you just give it in a matter of fact way, or do you sort of draw on your relationship with the service user? Do you base your interactions on empathy, respect, dignity? And you know, it's a type of kindness as well. So treating people with a certain type of kindness, not to the point where it you know, you become so caught up with someone that you're unable to deliver the care that has to be delivered, but you know, to do it with a sort of level of sensitivity, and you know, for the person to know that you actually have some compassion for how they're feeling, and that, so there's nothing wrong with showing a little bit of emotion and emotional kindness, really. And competence is another C that's really, really important. Do you know how to do your job? Are you capable of doing your job? Um, do you understand the issues, the health and social care issues that you're dealing with? And do you have the clinical and technical knowledge to actually deliver so things? So if you're delivering, say, medication or taking someone's observations, have you actually been trained to do that properly, and do you do it right and well and consistently? Again, or most of our interactions now are really based on research and evidence. So we do things for a reason, not just because we don't know what else to do, but we do it because it's valuable. So it's got to have a meaning for what you do. Courage. Now people might think, well, this is odd. I don't really understand this one. Why do we need courage? Because sometimes this work can be very challenging. And sometimes we have to speak up for our service users, especially when maybe they don't have the strength or the ability to speak up for themselves. And sometimes that can be in a challenging environment. It can be you challenging people more senior than you who might be making some decisions that you know is not what the service user wants, or is, you know, is something that they would feel, you know, culturally is very against the way they want to do things, but they can't really express themselves. So you do need to speak up for people. This is an excellent book actually called The Courage for Care. If you can probably pick it up on Kindle. But it's about all sorts of people having to make difficult decisions and having to support their service users in very stressful circumstances. So it's, yeah, it can be quite inspiring if you might want to read it. And commitment. A commitment to our patients is a cornerstone of what we do. And we need to build on that commitment. It is not just a job, care. And I think people need to really get that into their heads. It's not just a reliable paycheck. Okay. You have to be committed to doing that sort of work, and committed to seeing it through, and to seeing your service users sort of have the outcomes that you've aimed for in your care plan, and be willing to see that through. So it's quite important, really, a commitment to the role you do. This is vocational work. It's a little bit different to working in a shop where you just come and go. You will take some of your people's feelings home with you. You know, you will be concerned about, you know, if someone's taken a turn for the worse, are they going to make it through the night? Will I see Mrs. Jones when I get back there tomorrow? I'll stay on a bit later and help out because I just want to do this with her. You know, this role does ask for a level of commitment that quite a lot of, say, office jobs, you know, don't. So don't assume it's an easy job, and don't assume that you can do it without getting caught up in people's lives. So there is a commitment. You're also making a commitment to the service user that you will be there tomorrow as well. And you know, if you're not going to be there tomorrow, you need to explain to people why and what's going on. So that is the six C's, and they're a very important part of our values as a health and social care worker. And because of that, they've been incorporated in quite a lot of the practice and legislation, such, for example, the Government's Care Act, CQC's outcomes. some of the safeguarding documentation, all reflects on the 6 Cs. So they are a simple expression of values, and your organization can use them for looking at your supervision, guiding your team meetings, reflecting when you do your annual appraisals on the 6 Cs. It's a wonderful way to look at people's competencies and people's values when they do their annual appraisal. And they run through the code of conduct that has been written for most of the different types of care workers. So healthcare support workers, social care workers, nurses, midwives, social workers. There is elements of those 6 Cs in everybody's code of conduct. So you can see that's how it brings people together, and that the 6 Cs have created a consistency across the care working field. And the 6 Ks can be used very, very effectively in recruitment, because you could bring the 6 Cs into your questioning. You can create scenarios that relates to each one of the 6 Cs. And you can assess the values that people are bringing into this role. You can put them into person specs, and as I said, through your interview questions as well. You can use them at any level, from a basic care worker right up to a home manager. They can certainly be involved. You'll just find different ways of using them. And they've been really helpful again, because people are tending to use them now in their recruitment tools. Then that gives a consistency sort of from one care home to another, one hospital to a care home. If they're based around those same ideas, there's a consistency of health and social care worker recruitment that's going across the board. And it's really, really important. So nowadays, you might find questions are a lot more like scenarios rather than sort of yes or no questions. It might be saying, here's the circumstances. If you were that care worker, how would you resolve this? Or what could you do? That's the sort of questions you'd be asked. And again, if you prepared for a job in a care home, and if you really did some reading up on the 6 Cs and thought about how it would, how you could reflect your 6 Cs, that would have you well prepared for an interview yourself. And I know that some of you are in placements already, and some of you might be thinking long term of trying to work in this field and preparing yourselves for interviews. So, again, having these attitudes and being able to express these attitudes would stand you in good stead. 6 Cs have also been integrated into learning and training. And so the Social Care Institute of Excellence has mapped these 6 Cs, and they've related it, they've sort of picked it up in the diploma in health and social care, at the level 2, at level 3, and level 5. So those of you who are doing this course, you're actually looking at the level 3 at the moment. They are picked up a little bit in level 4 as well, not quite to the same extent, but they would go back to them again at level 5, but in a more management way. Level 5 is about management. So the mapping has shown, as I said, these 6 Cs never go away. Their values are relevant at all levels. So it's important that any learning provider that an organisation takes on to do some of the mandatory learning embeds those 6 Cs into their teaching practice as well. So hence here we're looking at it as part of your level 3, so that you're aware of your 6 Cs. And if you were doing some safeguarding training, or if you were doing some manual handling training, those 6 Cs would still come into the training. And again, in leadership, so as I said, they're looked upon at management level. So hopefully the culture of the organisation who is providing the care needs to reflect the 6 Cs as well. So everybody who's in a leadership role should be sort of reflecting to themselves, where are my 6 Cs? Am I showing it? Am I getting my people to show it? Otherwise, if they don't, then the organizational culture might not be as good as we want. And when they get inspected, in the UK would be by CQC. In your home country, you'd have a different inspection environment, but they would be looking at things like this as well. You would be expecting to show that. So those are the sort of main values and attributes, particularly for 1.3. I just want to address some other soft skills that are required in care that if you've got room, you can mention as well. And the soft skills I'm sort of thinking about are things like patience, flexibility, problem solving, conflict management, negotiating skills, and empathy. So I'm just going to talk a little bit through some of those. Patience, one of the most important skills for a care assistant is to be patient. And that's because you're working with very vulnerable people who may have diminished abilities, may not be as strong as they were, or as complimentous as they were. So they can be a lot slower in doing things, and you need patience. They may also feel frustrated with themselves, and they may take out the emotions sometimes on you, the carer, or they may have, an explosion of emotion when they feel angry with themselves. A good carer will always be able to remain patient and calm. That's your job. That's what you're there for, and it's really important that you are able to do that. So if you don't have a lot of patience, it's something you need to develop if you're going to be really successful in this role. Flexibility. You don't have to be as flexible as the girl in the picture. I mean, I certainly am not. But it's about flexible with your life. As I said, it is a vocational job. You can't just say, right, it's 5 o'clock time, my hours are up. If something's happening and you're involved in doing something with your service user, you're expected to finish what you're doing, really. And if this happens a lot, you'll usually get your time back somewhere. But, even though someone tends to work out the shift patterns and the timetables that people work, things have to change at short notice because the service users always come first. You might get a phone call saying, "Can you come in this afternoon?" Even though you were starting a bit later. "Can you come in earlier because so and so's sick?" It just doesn't, you just can't always work within your hours. Can you hold on for an extra couple of hours going home in the evening because the guy who's coming on night shifts car's broken down and they're going to be a couple of hours late, they're getting it fixed at the moment. We have to be flexible, and if you don't feel that you can make that commitment that you want to, maybe you're not in the right job. I think that's the truth of the matter. Obviously, we know people have to go home and pick up their children and that from places, and nobody wants to cause that problem. So they sort of, you'll think, oh well, you might ask the person who doesn't have kids to pick up, and that could be you, it could be someone else. But a little bit of flexibility. You say you want to take your break at 11, but something's happened, and you might take your break at 1 o'clock. Don't complain about it, just roll with it because something needed to be done. Problem solving. This is about thinking creatively, asking the right questions, and thinking about lots of different options. So not being closed mind, trying to think about different ways to resolve things. And it's really important that you have a positive approach to problem solving. That as a care worker, you don't see them as an obstacle, but as an opportunity to improve the life for your service user, really, and for yourselves. So, problem solving, if you've got that skill, you can do some training in it if you want to improve your problem solving skills. But again, it was a valuable skill for you. Conflict management. Well, conflicts in a healthcare setting can be anything from people arguing over certain things, arguing over when you should do something, to a major controversy that can pull the whole team apart. And they can arise between physicians and staff, the healthcare team, or more commonly, I'm afraid, between the team and the service user's family. That, you know, very rare I've been in a situation where I've managed a care home and we don't have the odd disagreement between the family about how they want things done and about how you may feel things should be done. And really, don't forget, you always sort of think back to what does the service user want? And if the service user wants something different to the way her family wants to do it, then you know you've got to support the service user, really. But it can bring you into conflict with the family sometimes if you speak up. They can have an adverse effect on productivity. If the team is at odds a lot of the time, that can have quite a negative effect. It can have effect on team morale as well. So if there's someone that you work with who you always end up squabbling with, that could really get you down. So you need to try and resolve it and nip it in the bud. Go to your manager and sort of say, you know, we're not work. Help us to fix this sometimes. If conflicts don't get resolved between the teams, it will affect the care that you deliver to your service user. Because if everybody's grumpy, people don't communicate very well, they don't listen to each other, they don't help each other out. And that all has a negative effect on the service user. So try to remember that. If conflicts start developing and you have to address them in team meetings, you can address them on a one-to-one basis with the person, but get it sorted really. Otherwise, there'll be high employee turnover, people will leave because people just can't. Some people are very sensitive and can't work in an unhappy environment, or people just won't contribute to meetings because they feel they might be put on by the person who's yells at them all the time. These things have to be stopped, otherwise you won't become a high performing team. Negotiating skills. So leading out of that, how do you manage conflict? Well, you learn to negotiate very well, and it's a two-way process that requires here, as I said, a presence of two conditions: a degree of disagreement or resistance for one or both parties. But there needs to be a mutual interest in an exchange that will actually have some benefit for both of you. Okay. So, if you do this for me, I'll do that for you on Friday. That's basic negotiation. Um, Here, my little screen is giving you full negotiation. This is really about if you go to a market and want to haggle for something. Lots of things to think about, really. So it's about be patient, listening to the other person, try to analyze the situation, use tact and diplomacy, be professional, control your emotions, use all your communication skills to get the outcome that you want. And sometimes accept the fact that you won't get 100% of the outcome you want. That's why you're negotiating, because somewhere along the line, you both agree to compromise somewhere. And that's usually the best outcome we can have from negotiation, is that we both agree to compromise without too much pain on either side. And again, this could be with you and the service user, could be with you and the service user's family, it could be with you and another member of the team. Okay, then finally, another soft skill that we all need to have is reflection. We've talked about reflection in other units, but you need to be able to reflect on what you've done. And if you're not sure, are you able to reflect on your skills? Are you able to go back and look at all the things that we've talked about in this session and think, do I have this attribute? Could I be better at it? What do I need to do to improve? Am I doing that one okay? Yeah, I'm happy with that one. Well, which is my weak spot? Is it communication? Is it negotiating? Is it managing conflict? And if you're really unsure, be brave, ask a friend to say, here, look at these are all the attributes I need to do my job. What do you think? Give me a score out of 10 on these different attributes. Be brave. Do it with someone that you trust, but let's see what they give you, and then think about, what do I need to do? The ones that they've marked you a bit low on, maybe it's listening, maybe you don't listen enough. Think about, what do I need to do to improve this, so I can really hit those 6 C's and those soft skills all of which are important to make me a better health and social care worker. Okay. And there may be some training that happens. There may be something you might do on your own, or you might discuss it in supervision with your supervisor and say, okay, I want to improve my negotiating skills. Is there something I can do? Can I get involved in a certain way? Okay, so there you are. Those are the attributes. And as I said, that addresses 1.3 criteria, which you'll be writing about. I think it's in task 1. I'll be going over the assignment with you at the end anyway. But so what you will need is just a summary of some of those, depending on how much word space you've got to do it in. Okay, summary, paraphrase, just bear that in mind. Okay, we have another set of slides in week 2. So we'll be looking at the concept of empathy. I've left that one off the bottom because I've got a whole set of slides for empathy, which we're going to look at next. Okay, so I will see you then. Thank you.